Hello and welcome to In Case You Missed It. So let's start with an update on what you're going to hear and what you're not going to hear next week in President Trump's first State of the Union address of his second term. You're going to hear him talk a lot about different affordability measures, lots of things with the economy. But on the healthcare front, you'll hear him brag about ending the kickbacks to the pharmacy benefit managers, the creation of Trump RX. He's going to talk a lot about health savings accounts, which is just giving money to people to spend on medical plans. And then their latest thing they're floating is allowing for catastrophic health plans. This would be much higher deductibles than Obamacare currently allows. So those are the things you're going to hear him talk about, none of which are going to materially impact any of us very soon in our healthcare costs and outlays. What you won't hear him talk about is new legislation details. There's not going to be a lot of details in there, just a lot of PR discussion. There's not going to be any talk about the Medicaid cuts, and there's not going to be any talk about reinstalling the enhanced ACA subsidies. So that's what you can expect on the State of the Union. Health and Human Services is going through a number of changes. There are 4 new officials being elevated into Robert F. Kennedy Jr.'s inner circle in advance of the midterms. This is all with the eye on being able to move faster and go further with their Make America Healthy Again agenda. This is a race to November because Republicans are starting to show you that they believe the blue wave will be real in November, and they're going to lose the ability to do a lot of the things they want to do. So they're rushing to get lots of things done right now. In an FTC settlement, Cigna has agreed to change some of its PBM business practices, specifically in and around the customer charges of insulin. So in this agreement, they've agreed to a lot of things the feds were asking of them because it was proven that their subsidiary, their PBM Express Scripts, who you might have heard of that, it's owned by Cigna, were charging an inflated cost for insulin prices through secretive and non-transparent deals with the drug manufacturers. So Cigna is one of the 3 pharmacy benefit managers that have been put on blast by the FTC. Also CVS Caremark and Optum Rx, which is owned by United Healthcare. Those also have settlements that will be coming here soon because of wrongdoings within their pharmacy benefit manager practices. The state of Nevada debuts a public option amid the tumultuous federal changes of healthcare. So what is the public option? So what you might remember it as is government-funded insurance policies. So no insurance company backing them, just the federal government being the insurance company. Well, these new versions of public options are not necessarily that. They're really more public-private partnerships than true government-sponsored plans. And what they're doing is partnering with private insurance companies, but using the power of the government to put lots of regulations on insurers regarding rate increases, regarding who's in the system, hospital systems and providers required to be in the network. This has been done other places. Washington and Colorado have done this. They've had some different varying degrees of success. But the problems they're having is lack of participation from clinicians, from hospitals, from other care providers, as well as just the simple fact that the insurance companies aren't able to live up to these mandates of keeping the insurance premiums lower compared to other policies on the market. So the Nevada law specifically requires that the public option plan premium cost compared with the benchmark silver plan on the market reduce its prices by 15% over the next 4 years. 15% sounds like a lot, but over the next 4 years, with rates going up at an average clip of 8 to 12%, 15% lower than today's rate, or 15% lower than 4 years from now rate is not going to be any lower than what you're paying now. So these public options have been popular for people to talk about it. Legislators like to talk about it. They talked about it in Maine. They talked about it in Minnesota. They talked about it in New Mexico. And all 3 of these states have canned this option because they can't get the affordability they need. They can't get the participation they need. Thanks for stopping by. See you next week.